Thanks very much, Steve, and thanks to Focus Springfield for your continued efforts to ensure the continuity of government for the last year. We owe a great debt of gratitude to Focus Springfield. I'm Jesse Letterman, chairman of the City Council's COVID-19 Response Committee, and we are calling this meeting to order on February 2nd. We're joined by my colleague, Ward 7 Councilor Tim Allen. We're also joined by the Commissioner of Health and Human Services, Commissioner Helen Colton Harris. We're joined, as I said earlier before the recording begun, by Melissa Olson from Senator Markey's office, Raekwon Reeler from Senator Warren's office, and Kareem Kabodia from Congressman Neal's office. And we're going to begin tonight with our weekly briefing from the Commissioner regarding the municipal response to the pandemic and anything new that is on the horizon. Commissioner, thank you so much for giving us your time. We know you have a team in from Washington right now, so great to see you.
We're having our site visit, so that's exciting, and at the same time extremely nerve-wracking. So thank you, Councilor Letterman, for again holding this very important meeting to be updated around COVID. The update really is twofold. One is that our cases continue to drop in the city of Springfield, not as significantly as we would like them to, but we have seen 134 less cases the week previous. We've seen 91 cases less 1 week ago, and this week there were 41 less cases. So our case count is going down. However, what we are seeing really is also something that is new because the colleges, for the most part, have been shuttered. We are seeing cases show up from our local colleges. And so we continue to watch those numbers, but they are concerning, obviously.
Yeah.
1 minute, Commissioner, I apologize. Councilor Whitfield, you're not muted, my friend.
Sorry.
That's okay. We are joined by Councilor Tracy Whitfield. Councilor, I would have done it for you, but I don't think I have I don't have the controls yet. Commissioner, sorry.
So we are following cases at local colleges that are now clusters. So that is different than last we spoke. So right now, last month in December, we had 4,496 cases. So far in January, we have one more day to go. We have 4,257 cases. So we are seeing, again, a reduction, but not a large reduction. Also, the cases by age group continues that we have our and under age group is 71% of our cases. And then 28% of our cases are over the age of 50. The hospitals, as you know, are also seeing a decrease in cases. So we're excited that the hospitalization rate is going down, which is really very important. All of the graphs that I have talked about today are up on the city's website. There are 9 of them. I invite you to take an opportunity and look at them. And if you have any questions that I can answer about the graphs, I'm happy to do that. The zip code information is on the website as well as the cases by age, the cases for the past 3 weeks. And so that data is available. But overarchingly, our cases are going down, but we are seeing an uptick in the cases for our college students. The vaccines, as you know, the rollout has been bumpy. And so we work to set up sites across the city using our libraries and elder affairs to help our seniors 75 and older register. That will stay in place for seniors 65 and older when their turn comes. We are also setting up our sites for the second doses, which will begin this Friday and move into the following week and the following week after that. And that should complete the second dose for the 1,400 individuals that we need to vaccinate. We do have those 1,400 doses. And so it's important for us to let our first responders know that they don't have to worry about their second dose. It is in the freezer, so it is here. And so that really can complete my update. I can answer questions, Counselor, if you'd like.
Thank you so much, Commissioner. So I know we do have Councilor Whitfield and Councilor Allen. If either of you have any questions for the Commissioner, please feel free to just raise your hand in the chat. And Commissioner, have we heard anything further from our state partners about future vaccine doses and how many we might be able to expect coming into the city of Springfield beyond the second round of doses for the phase 1 folks?
That's an excellent question, Counselor. We have not. So right now they are looking to make sure they have vaccine for the mass vaccination site at Eastfield Mall. We are also, I should say, we are standing up two more testing sites, one at Rebecca Johnson and the second one at Putnam. But we have not heard when we as a municipality will get more sites so that we can extend our ability to vaccinate our residents.
Okay, so I know everybody's sort of very anxiously awaiting that information from the state. I know the administration is as well. And, Councilor Williams and I over the weekend had a chance to stop by the Eastfield Mall site, which was very well organized and seemingly staffed with local medical professionals who had been hired on by the company that was contracted. But of course, we all know not everybody is able to get there as we enter the future phases that include such larger populations. But I do want to thank you, Commissioner, and the mayor for moving so swiftly to set up a call center. I've been able to share that information with a lot of seniors that have reached out to us. So I do see Councilor Whitfield with her hand up, and then Councilor Allen. Councilor Whitfield, you're still muted.
See, I'm muted when I'm not supposed to be. I'm unmuted when I am. But anything that was said, that wasn't me. I had ran to the back. So that was my daughter. I don't know what she said while I was unmuted. But thank you all for joining us. And Commissioner, thank you for your updates every week. And I was on the Mason Square C3, and vaccines and testing centers come up every single week. So it happens Tuesday. So it's always fresh in my head. But everyone's thankful that there's a testing center at Rebecca Johnson and Mason Square now. So I just wanted to say thank you for working diligently on that. The question is, well, there were so many, but one question, and I'm only going to ask two, was, do you know the amount of vaccines that has taken place in Springfield thus far?
I can only tell you what we've done. We've done 1,400 doses. I am not sure how many were done at Eastfield Mall, and that's going to be difficult because that's a regional center. So it's not just Springfield residents, and that's why I certainly am working, and I know that the mayor is, we need to have smaller centers in neighborhoods where people are able to get to once their time comes, so that we can focus on Springfield residents. And so I think all of us need to work together to make sure that happens.
Yes, I think so as well, because one of the concerns was transportation to getting out to the Eastfield Mall. And I was wondering if, I was going to call you on this, but I just got overwhelmed, and see if we could use some passes for folks that live like in a certain miles away from Eastfield Mall, or if I'm going to call PBTA and see what assistance they can give. But have you heard anything about that as far as help for people getting there?
You're talking about vaccine?
Yes, to the Eastfield Mall.
We do not have a transportation system. It's difficult. The mayor was thinking about that as well, because we do know that there are a number of seniors who are letting us know they can't get there. We don't have a transportation system at this point. Perhaps there's an arrangement we can make with Vanpool, working with our senior center to work out some transportation. But right now, Councilor Whitfield, we do not have that system in place. And I want you to think about the logistics of this, because everybody won't have the same time. So someone in Springfield may have an 8 a.m. in the morning, somebody else may have a 2 in the afternoon. And the question is, how do we set up a system that's equitable so that we can service the entire city of Elders? And unless we can do that, we really don't want to set up for failure, because as you know, it'll become a challenge. We could pick somebody up, we couldn't pick someone else up. So we want to make sure that when we do it, we can do it for the entire city.
Yeah, I definitely agree with that. And the other question that I had, I kind of lost it. So I'll circle back when I remember what it was. Thank you, Counselor.
Thank you.
Thank you, Vice President Whitfield, and we can circle back to you. And, you know, on that same point too, I don't know if we've discussed this before, but around similar to the transportation question, but also once we have the neighborhood sites set up, I think perhaps checking in with AMR, or if there's another contractor we could work with to actually do something mobile, you know, and have you know, possibly with individuals who may be disabled or unable to actually make it even to a neighborhood site, perhaps be able to reach out and go directly to them on an appointment basis.
I remember my question. I'm sorry.
No, we did discuss that, Councilor Letterman, and what we are looking at setting up is drive-through systems so that people can get the vaccination, they can drive in and get it, and then they will need to park in a certain area for 15 or 20 minutes while we have medical professionals observe them. So you're absolutely right, but that certainly is something that we have not set up yet, but AMR is in a position to do vaccinations as a drive-through venue.
All right, Vice President Whitfield and then Councilor Allen.
Okay, sorry. So I got some concerns about scheduling, and this may not just be for you, Commissioner, but about scheduling the vaccination for seniors. So they said that they were using an online portal, and they would go in there and they would say there's no appointments available, similar to like what CVS did. Mm-hmm. And so they said we have to check back every Sunday, because I guess they were checking every day. So how would the staff at the library be able to schedule the appointments? Is there a different calendar that they use? Like, I don't even know what the procedure is for scheduling the appointments.
So what happens is a city resident will call a library or the senior center. The senior center employee will stay on the line with the senior and go to an open slot. If they do not find an open slot, senior's name and address and information is taken down. The staff checks constantly for open slots. And once we have one, we put the senior's name in, call them back and notify them and finish filling out the application. I mean, what has ideally happened is that we have been able to schedule people weeks out. I mean, we don't know when that vaccination is coming, and that's a part of what the state is dealing with. They don't know how much vaccine they're getting and when. And so it's hard to schedule slots sometimes for them as well. But it appears that the library system is working, or I haven't heard any complaints. Let me say that.
Okay, thank you. Maybe it's just a training gap where they have to use a drop down. I haven't been in the system yet to select different dates, but they weren't getting it, and they were just saying it's always full, it's always full. So I did give them the information provided by your department to call the library for help. So thank you for that service again.
Yeah, I will call the state. When you hit the drop down box, it asks you for certain categories. It won't let you go beyond 75 or over with 2 comorbidities. If you're 65 and any other category, it won't let you in. So it's now just phase 1 and then that category of phase 2. Anything else, it will not let you register.
Okay, maybe that's it. Thank you.
Thank you, Vice President Whitfield. And also on that note, from what we've heard thus far from the state, the commissioner may have said this, I could have missed it, is that they'll be adding appointments on Thursdays is when they'll add appointment slots.
That's correct.
To the commissioner's point, we don't know how many, you know, so Councilor Allen.
Thanks, Chair Letterman. Yeah, a couple things that came out of, you know, I'm chair of Elder Affairs, the Elder Affairs Committee of the Council this year, and we held our first meeting last Wednesday, and there were 7 counselors there, which is a lot of counselors at a committee meeting. So the primary topic was exactly what we've been talking about here. And I don't need to reiterate it because it's all the same stuff over and over. It's just, can we figure out the best system we can figure out? And all the concerns about signing up and vaccines, et cetera, elders not having PCs, not being tech savvy. So I went to the senior center I went to the Jordan Senior Center on Thursday and spent a couple hours there with Sandy and her staff. just to kind of boost them up a little bit and see how it was going. And they were getting a tutorial on how to use the system, et cetera. And over the course of the couple hours I was there, I talked to them and to Sandy about things we could do to make life easier. And among those things were headsets for them to use, since they've turned into a kind of a call center really at this point. Headsets, and then if we got more staff to help them, laptops or iPads or whatever, which I think might have been taken care of by the library people helping out. And then the third thing was transportation. So I happened to be on the phone with TJ, and I talked to him about their needs, maybe for transportation support and certainly for headsets. He was totally receptive to spending. I don't know if Sandy's put in any forms yet or if you've talked to her, Helen, about it, but the headset thing would be an immediate benefit to them because they're on the phone constantly now. And so I talked to Sandy today just to see how it was going, kind of thing. So that was hopeful for me that and TJ, as you said, Helen, he mentioned van pool and all that. So I think there's things that can be done, as you know, and I was kind of hopeful. The crew is psyched. They were ready. They were on the phones constantly when I was there, talking to people and, helping them register, et cetera. So it prompted me, Helen, to think about kind of what you were just thinking, kind of what we've talked about already in this meeting a little bit. If we're setting up testing sites at wherever, Putnam and somewhere else in Mason Square, is there any chance of setting up our own vaccine sites? It seems to me that being aggressive here is the thing to do. And I just didn't know if you've had that conversation with them, Helen, along the way, or I know you're going for those 2 testing sites. Is there, 1,400, I know we've got more than 1,400 people vaccinated because we don't know the Eastfield Mall numbers of Springfield people, but I'm just trying to think, I've never seen hardly ever 7 counselors at a meeting and at a committee meeting, and everybody's interested. It covers every ward, every individual in the city. I'm suggesting we consider asking for the moon. If we can, maybe we'll get it. Because everybody wants us to be better.
We have Counselor Allen, thank you. So I have 10 schools ready to go. In terms of ventilation, I have a site in every neighborhood in the city of Springfield that I can move to when we have the vaccine. And I want to use that as a caveat because right now, the mass vaccination sites are the priority for vaccines. And so those vaccines are going to those sites. We have said to the state and we have said to folks at DPH that we are prepared to do smaller vaccination sites in neighborhoods. We will probably, because of staffing capacity with AMR, we will probably rotate them so that we're doing a different site in a different neighborhood over the course of a week, potentially. But yes, I have those sites, I've got those schools. The only challenge is gonna be when we move to general population, schools may be in. And so I may need to think about alternate sites other than school buildings for the April to June, if in fact we stay on track for April to June for general population. Obviously, if it's after June, we'll be fine with the schools again. But to your point, we have talked to DPH. They know we're ready. They know that we have the capacity to do neighborhood sites. We cannot do what the larger sites do, but we certainly can do up to 300 a day.
That would be great. I don't know what we could do to help that along, other than I know you need to know if you're going to have vaccines to give out, but anything I can do, or I don't want to speak for the whole council, but anything we can do to make it easier for people, I'm sure everybody would support, because the idea, even if we got vans and the senior center people drove people out the Eastfield Mall, et cetera, even if we got over that hurdle, or the van pool or whatever, there's so many people in Springfield, 150,000 more who need to be vaccinated. And, I don't know if that's an exaggeration. I know we don't vaccinate kids yet, but it's a long ways out in the system. Anything we can do, I would be happy to support.
Well, we have 26,000 seniors over the age of 55. And so that just goes to show you the number of individuals we have over the age of 55. I don't have the 65 or 75 and over number, but that's quite a large number of individuals to vaccinate.
For sure, for sure. I'm all set, Mr. Chair.
Thank you, Councilor Allen. And I think that, this has been a subject of discussion at our last three and our only three, because we've only had 3 meetings thus far, weekly meetings of this committee relative to the status of the neighborhood sites. And I think something that the council has done throughout the pandemic that we might be able to do in this case, just to provide some additional support to the commissioner's call, is to perhaps pen a respectful letter just to the state, emphasizing the need for, when the dosages come in, to also prioritize the distribution to communities for local distribution in addition to, or in parallel to, the mass vaccination sites. I think the mass vaccination sites serve a purpose, right? In that if you are able to get over there, it will take some of the pressure off of local sites if you have the resources to go and do that. But we still need to make sure that the local sites are stood up as soon as possible. So I'd be glad to draft that and put it out for folks to do together.
That'd be great. Yeah, that's a good idea.
We're joined now by the President of the City Council, Marcus Williams, who has his hand in the queue. So I'll recognize the President. I'll just remind folks the Commissioner was very generous to join us. She does have a team visiting from Washington, D.C. for a grant review. So we want to make sure that she's able to leave us shortly. And we also have our other representatives from our federal delegation that we're here to meet with. So we'll take President Williams' question for the Commissioner as the last word with the Commissioner.
All right. Thank you, Mr. Chair, I should say. And I also want to just thank folks from representatives of the federal delegation for being in attendance today as we fight this pandemic on the ground heads on. I just wanted to ask, it actually was a question that came after Councilor Allen's question regarding Eastfield Mall and transportation. And Commissioner, I was just wondering, how important are the data points for those that are actually getting vaccinated within the city of Springfield to your department and the city as a whole? Because the one thing, as you alluded to, Eastfield Mall is not capturing that information. And I just want to make sure that, of course, for other sites that we are managing, we will have access to that. So I don't know if there should be some cross of information with Eastfield Mall relative to capturing that, or I just want to gauge how important that is to you all.
It is very important, Council President Williams. As you know, our poverty rate and our access to healthcare and to those very systems are really, we experience a lot of disparities. I'd like to make sure that we have vaccination clinics in our predominantly Black and Brown communities, where I think we've got some work to do around education, and we will continue to do that. But I would like, ideally, to be able to be in those neighborhoods so they can have immediate access. Now, one of the ways that may happen futuristically is a vaccination site at Brightwood Health Center, one at Caring Health Center, one at Mason Square Health Center. That would take care of 3 areas of our city where we know that access is an issue. So I think we can all work together to assure that happens. And I look forward to making sure vaccines getting the arm as soon as possible of all of our residents, because I believe that's going to be our path forward. We still have heard from many residents, as you know, who are not wanting to take the vaccine. There still is vaccine hesitancy that we need to work on. But to your point, it's very important that we get the information to our residents, as well as provide them with the path of least resistance. And that means it needs to be close, it needs to be in the neighborhood, and it needs to be staffed by people who are of and from this area, the city of Springfield and the Western region. So thank you for asking that question.
Thank you, Commissioner.
Thank you, Mr. President, and thank you so much, Commissioner. I will draft that letter this evening, and we'll hope to get that out in the very near future to support those efforts by your department. We appreciate you very much.
I just want to say how appreciative I am of this committee. I think it's important and that you have guests on who can continue to inform the conversation. Thank you, Council President Williams, for setting this up. I think this is a wonderful step forward for all of us. So thank you and have a good evening.
Thank you.
Okay, so we'll move to our second agenda item now, which is a discussion with our guests. As I mentioned earlier, we do have representative from Senator Markey's office, Melissa Olson. We also have Raekwon Wheeler from Senator Warren's office and Kareem Kabodia from Congressman Neal's office. And Kareem, if we were in chambers, I'd say welcome back to your old stomping ground, Springfield City Hall. We appreciate all the work you were able to do here during your time in the mayor's office, and we're glad that you're moved on to represent us in the congressman's office. We're also joined by our Deputy Financial Officer, Lindsay Hackett, and our newly appointed Budget Director, Melanie Jacoby. Congratulations, Melanie. And we also, just for the record, so folks are aware, we do have some members of the media here, including Mass Live, The Republican, The Reminder, and Western Mass News. So I think what might make the most sense is just to give our representatives who are with us from the offices a chance just to tell us a little bit about what they're hearing and what we can expect. I know that things are very much ongoing in terms of the negotiations in Washington, so I know there's not a lot to really report yet, but we were hoping that you could be just informed by our conversation, including the previous half hour, and also take back some information to your offices to inform that negotiation in the next month. So I think we'll probably start with Raekwon from Senator Warren's office, then we'll go Senator Markey and then Congressman Neal.
Sure. Thank you, Councilor Letterman, and thanks for extending the invitation for me to join. It's nice to meet all of you. If I haven't properly introduced myself or met with you all at some point now, but my name is Raekwon. I go by Ray. I'm the Western Mass Regional Director for Senator Warren's office. And as Councilor Letterman has said, negotiations are still in the early stages. They're still ongoing. So we're waiting on a lot of information, but I definitely found the first half of this conversation to be helpful, particularly around the local vaccination sites and the need to get vaccines stood up and ready for the general population as well. One thing that I did want to highlight that the commissioner did touch on in terms of, and that's been a theme of the conversation from the first half, was the need to address sort of the disparities that we're seeing within the community in Western Mass, Springfield in particular, given that we do have a high, Black and brown population in the area. So one thing that our office has done, as well as along with Senator Markey's office and Congresswoman Ayanna Pressley, is we recently wrote to HHS, so the U.S. Department of Health and Human Services, to address sort of the racial, ethnic, and demographic disparities that we're seeing in terms of a mass scale or the early stages of the rollout, the vaccine rollout. So it's developing and calling on all relevant agencies involved with the process to address those issues that, whether so that we can focus the funds and get them to the areas that are hardest hit by the pandemic, as well as make sure that when we do scale up, as the Biden administration is calling for more vaccines, more of a supply to be made, that it does get out to those areas that are hardest hit. And so that's where we are. Again, we're continuing to monitor it and do what we can to push and advocate for, more transparency around it. And of course, to get it out to the areas that need it the most, disproportionately impacted by it. And just before we joined today, moments before we got on the call, our team was notified, and we all received news that the Senate recently, and just goes to show how these things are still developing, that in a 50 to 49 vote in the Senate, that they move forward with the 1.9 trillion COVID relief bill through the budget reconciliation process, which is a way to work around without the need for the 60 vote threshold. So again, still developing, still coming to terms with it, but we'll continue to monitor and thank you for the information. Again, I'll bring this back to the team, and anything that you all have or questions, I'm happy to share those with the rest of our team as well. But thank you for, again, extending the invite.
Thank you, Ray. And we'll move to Melissa Olson from Senator Markey's office.
Thanks, everybody. Thanks for inviting us tonight. Ray hit a bunch of the points that I was planning to make too. So obviously our bosses have been working very closely together on a lot of these issues, especially around disparity and vaccine equity. Senator Markey would like to see about $1 billion put into the COVID relief package for vaccine equity rollout. We've seen it from east to west in the state that it is not happening, and we need to focus on it. A couple other priorities that Senator Markey is really focusing on with the COVID relief package is the recurring cash payments, minimum $1,400 minimum that they are recurring, i.e. you don't just get one like last time. He really believes we have to help people through this crisis and not just give them, one check. We also need to see more aid for our cities and towns from the federal government, which is something that he has been calling for since the beginning. And E-rate is a priority for Senator Markey. It's his baby, it's his bill. It helps our, especially our underprivileged children have access to the internet. It started as a program that was in schools, and now as we're seeing with our kids having to learn remotely, that they need help at home too. So that's another priority, and he'd like to see $4 billion at least for the E-rate program. So yeah, Tracy, exactly. So as Ray said, negotiations are hopefully going to start in the next day or so in the Senate. We stand supportive of President Biden's package, and we feel the same way that he does, that we have to be sure that it's enough for people to help get them through this crisis. So thank you.
Thank you so much, Melissa. And Kareem Cambodia.
Thank you, Chairman Letterman, and thank you to the council and everyone else in attendance today. Right now, we are at a point in time where we do need to be more aggressive about our approach into helping the families, and especially the students and the children who are currently suffering through this pandemic. Thousands of jobs have been lost, and without a strong stimulus package and without continued assistance to our families and our children, we will continue to struggle. And the congressman has continued to fight for people, our constituents, both nationally and those in the local communities. He's continued to champion the earned income tax credit as well as a child care tax credit. And in addition to that, we're continuing to fight along with our colleagues in the House and the Senate to make sure that not only are we providing sustainable livelihoods for our community members right now, but also that we're making sure that we're looking towards the future. And through infrastructure spending, through green jobs, that's the only way that we'll be able to move forward one of the greatest economic downturns in our country's history. I look forward to continuing these conversations, answering any questions, and I just want to commend everyone here for their continued work as well.
Well, thank you to all three of you, for joining us today and for the work that your offices are doing and that the senators and the congressmen are doing. We really appreciate the opportunity to be able to have a dialogue. This setting, this committee that the president created really is meant to be a platform for those types of conversations to happen. So we're meeting weekly, at 4:30. I know many councilors are in touch with you all regularly anyways. What I'd like to do is take some questions and comments from councilors for you all to take back. I see a number of hands in the queue. There's one issue I want to raise first, and then we'll move through. And I have a couple others as well, but I want to make sure everybody gets equal time. One, though, is interesting. It's sort of related to the pandemic very closely, but also is a longer term issue, which is the move by Comcast Xfinity to implement data caps in the Northeast region for the first time. Almost every councilor here is the co-sponsor of a resolution that we'll be taking up on Monday in opposition to that. And we'll also be committing through that resolution to have some conversations in the coming weeks and months about alternatives to this type of issue that we might be able to move forward and pursue as a community. But I know this is something that Senator Markey has spoken about before, but I wanted to make sure that does go back because it is really an FCC issue. I mean, we're able to raise it, and that same resolution is actually being heard tonight in Holyoke. It's going to be heard in West Springfield at their next meeting. It's going to be heard in Northampton and Agawam. So, really the major municipalities in the region are speaking out about it, but I think it's one that the federal delegation needs to consider because we are already hearing from dozens of constituents on a weekly basis that they are getting notices that they're going to hit this data cap. And I know that some of the internet service providers have indicated that it'll only impact a small number of people. I think they say 5%. But in a city the size of Springfield, 5% is a significant number of households. But furthermore, I don't know that those numbers are accurate because from the numbers of people that are reaching out to us, it's everybody from households that are 2 people to households that are whole families of 6, 7, 8. So it doesn't seem consistent. And I'm hoping that the FCC, at the urging of our federal delegation, may be able to take some action on this, especially, but not only during the pandemic when people are working from home, learning from home, accessing healthcare from home. So with that, if you can take that back, we appreciate it. We'll start with President Williams, and then we'll go Councilor Allen and Councilor Whitfield.
Jesse, I can just tell you quickly that it's an issue we're involved with currently that we're looking into at the FCC.
Excellent, thank you. Okay, President Williams.
All right. Thank you, Mr. Chair. Good to see you, Melissa Kareem and Raekwon. This is, you might not actually have the answer to this question on its face, but I still think it's important to ask it. Within the Black and Brown community, we're dealing with a lot of concerns over the vaccine, its safety, and I think those concerns are certainly tied to past historical events, which left those communities feeling certainly marginalized and victimized, I will say. So I just want to ask, is there any work that can be done on the federal level to help dispel some of the myths that exist about this vaccine, with particular, I would say, interest as it relates to approaching those communities of color with the cultural sensitivity it needs to get them to take the vaccine? Because as we're looking at these death rates, it's certainly disproportionately impacting folks of color. So I just want to know if has there been any conversation or discussion on that on the front line?
I appreciate that question. And one thing that Senator Warren, I know definitely when answering that or taking questions in that same vein, she'll say it starts with trust, right? Like building trust and having trust with these communities to make sure that they know it is a safe vaccine, right? We've seen elected officials as well as former presidents publicly take the vaccine to build support and to make it more, likely that people will not question it, but are aware of the safety and the necessity for it in order to help stop the spread. So again, it's a valid question. We definitely have seen that. It's come up in our communities. And so again, it starts with building the trust with Senator as well as Senator Markey's office and Senator Warren's office, again, calling on HHS to release data, be transparent about who's being impacted by this, why it's important to release that. We've also written to the CDC to capture that racial data from the beginning of the pandemic into now. So we'll continue to do that along with the rest of the Massachusetts delegation to make sure that it's the information is getting out and we are not night of who's being most impacted by this. Thank you for your question.
Appreciate that. Thank you.
Councilor Allen.
Thank you, Councilor Letterman. My question is going to be back to what I was talking about before. If we're going to try to set up individual vaccine places in Springfield, is there help that you guys could give us from the federal side to do that? Raekwon or Kareem or Melissa, you might not be equipped to handle that question, I understand, but it's going to take some influence and some push if we're going to get that. And working through the system is great, and I know we are often successful with it, but this is, we have so many marginalized people in Springfield, and getting them registered is one thing, getting them an appointment is the second thing, getting them to the appointment is a third thing, and then doing it again 3 weeks later. The logistics are really overwhelming, and anything, I don't know what influence you have over the process in Boston or wherever the vaccines are or whatever, but I would request that any or all, the three of you, think about it, see what you could do for us, because, we've done okay. We got 1,400 vaccines we've done, but there's 25,000 people to go over 55, and every day it's they run out of vaccines or whatever. It just the challenges in a city like ours are bigger than they are in many other cities and towns. So I just don't know if any of you could comment on it or what we could do that could actively solicit your help. Jesse said we're going to write a letter. That's good, but do you have any specific thoughts on where that letter should go or things you could do? Thank you.
Tim, I would say two things. One, one of the priorities that we mentioned from our federal delegation is aid for vaccine rollout. So I think that would be right in keeping with helping with that process.
Yeah.
And the second thing I would say is that we're starting to see the vaccine distribution become a bit more federalized than it has been. Today, the Biden administration announced that they're directly sending vaccines to pharmacies, which is new. So I think that those two things would be very helpful. But I also agree with what Jesse had said earlier about, writing to the state who currently is in charge of the rollout as to streamlining the process. I know Senator Lesser also has legislation pending, if I'm not mistaken, to try and help with the rollout. So I'm hopeful that all those things will come together.
I think, Melissa, to Councillor Allen's point, and Councillor Allen, if I may.
Yeah, go ahead.
I think to Councillor Allen's point, one of the issues is, and the commissioner brought this up earlier too, the actual availability of vaccine, and so I think that to the degree that you might be able to come back, get back to me later on with some answers around more about what the federal government's going to be doing to get vaccine to states, that would probably be helpful too. And as vaccine production ramps up, I think that's one of the pieces to this as well. And I know that's not something that you guys can just answer off the top of your head. But
yeah. No, we can certainly circle back.
That'd be great. And Kareem, did you want to?
Yeah, just to mainly echo off what Melissa said, it is centered on an aggressive vaccine approach and making sure that there is the available funding necessary to provide vaccines to everybody who is in need. And it does lead back into, I definitely look forward to continuing these conversations because I feel that both Tim's question and Marcus's question are very related, and that it needs to be viewed from the point of addressing it and who is currently just doesn't have as much access, whether that's transportation or having a close by vaccination site, and the racial disparity that is in play here. And so it is a big question, but it is something that we need to discuss.
Okay, thanks.
Thank you, Councillor Allen. Councillor Whitfield.
Thank you, Councillor Letterman. So my first question is going to be more around finance, and I wanted to ask Lindsay specifically, have the city developed any additional financial burden from opening the vaccine sites, providing additional help, things like that? And if so, is that something that we need additional funding from the state?
As of now, the vaccine sites are run by the state. If that changes and we're leaning on the municipalities to run these vaccine sites, whether it be out of necessity, out of want, we absolutely will need funding to assist with that.
And the reason that I asked you, Lindsay, is because I haven't heard a lot of conversation around additional funding when it comes to the vaccination support and even testing center support. I don't know that I know you get COVID funding, and I don't know all of what it's specifically for, but it's gonna get expensive to get everybody vaccinated in the area. And so that's something that we definitely have to think about. In addition, I just wanted to mention to President Williams, the Mason Square C3 is holding an information session we're inviting DPH, but we haven't got a response yet. And some doctors will be on the panel along with Commissioner Carlton Harris on February 23rd to inform the community about the vaccine. And so there are different community organizations that are creating this awareness. However, one of the questions that I got today in the meeting was, when you all, and I'm talking to Melissa, Raekwon, and Kareem, initially start talking about COVID vaccine testing, do you look at it from racial equity disparities up front? And when I say racial equity disparities, I'm going to say like one of them being housing, because we know that a lot of times people in the Black and brown community, because they have been redlined or there's some other racial situation going on, they haven't been able to live like other folks, right? And so there are more folks in an apartment building, more people in an apartment. So when you have these conversations, do you look at it from that, even with health disparities that we have because we can't get adequate insurance and those type of needs? So I wanna know if those are included in the discussions up front, or is it oh yeah, people are talking about this, because it seems like nothing changes over the years. It's always reactive. It seems reactive to me. And so I just want to see what the congressmen and the senators do in these instances.
And I think that in terms of how the senator thinks about it, she doesn't, look at the issue in a vacuum. So she looks at how it's impacting those different areas. So as you rightfully pointed out, when we talk about COVID-19, it's not just, the health disparities, it's going to impact, we know there's childcare as a factor in sort of in what we're seeing. We know that housing is a factor. We know that, jobs in general, unemployment, like it's across the spectrum. So when we're calling for, that data, that information from, HHS or from CDC, it's to get to the root of all of that so that we can see who's being impacted the most, not just by contracting COVID-19, but who's being hit hardest, right? And when we talk about things like the cancellation of student debt, that's tied into, the issue of who's being impacted, who's struggling, who's losing. She recently talked about how women are going to be impacted by this because of the lack of childcare. They're working from home now, and because they're not able to work or get those hours, it's going to affect their retirement later on down the road. So again, it's looking at the issues across the board without losing that lens of race, of the demographic diversities, demographics. So where we're seeing these clusters, geographical location, of course, housing, it's across the board. So I'd say it's definitely something that we're mindful of, and that's why we continue to push and call for that information and that data.
Thank you, Raekwon. That was a great answer.
Thank you.
Kareem?
Yeah, similar responses that we have to. There's no way that you can look at this without focusing on that racial equity and those health disparities, specifically in our communities of color. Last year, when the CARES Act was released, both Congressman Nail and joint with Congresswoman Presley reached out to the Treasury to determine why there were certain disparities and to see why there were additional disproportionate portions of how that act was implemented. And going forward, both within the scope of what we're trying to do and making sure that everybody's vaccinated, making sure that people are getting back to being healthy, and as we move forward in terms of our economy, factoring in racial equity is of the utmost importance to the congressman, and he'll continue to work towards that.
Thank you, Kareem. Great answer as well. I don't know, Melissa, if you wanted to.
They didn't. I would just add that, in addition to what Kareem and Ray said, which is completely on target with Senator Markey's priorities, another thing that we've seen that is directly related to the COVID inequity, and Jesse knows as well from working with us on it, is climate inequity. We're seeing that, communities of color are disproportionately affected by asthma and other breathing problems because of their poor air quality. And then those same people, when they get COVID, have a much harder time recovering from it. So I would just say, we're looking at the disparity issue as a huge world, not just this tiny issue.
Thank you, and I appreciate that, because while everyone says that they're looking at it, we still get less vaccinations, and we still, on a national level, I've been looking at some of the data, and some of the states with a high population of Black and brown people still are getting vaccinated at a much slower rate than white people. And so I just wanted to make sure that in Massachusetts that we really look at this lens and ensure that all communities are treated equally. I want all people to get the vaccination equally, and not, there shouldn't be any disparities, but there should be equity across the board. So I just wanted to say that.
Yeah, I'd also like to just add on to that, as Tracy just said, and Melissa as well, that our delegation is in strong agreement on what needs to be done. And that's one of my favorite things about living in Massachusetts, is the strong federal, state, and local legislators that are working towards bettering our communities. I think one elephant that we always have to be mindful of is the previous administration and their negligence towards addressing the issue of COVID and moving forward through that. I hope, and I know that the congressmen, as well as our senators and across our delegation, are committed to aggressively working towards bettering this. And we do have a president in office now who has stated that he is also committed towards working towards that goal. And so now we just need to get to work.
Thank you, Kareem. We're coming up on about 5. Oh, I'm sorry, Councilor Whitfield, did you have more? No.
I just wanted to say thank them. Thank
you, Councilor Whitfield. And so I know we're coming up on 5:25. We usually try to keep our meetings to an hour. I did want to ask Lindsay and Melanie if they had anything on the financial side that they wanted to send back up to the senators or the congressmen. And we welcome our special guest also, which are always welcome on our committee meetings. So please, Melanie or Lindsay, if you wanted, I know there's definitely some pieces to the relief bill that's coming that we'd like to see in there. So I'll hand it over to both of you.
Thank you so much. I would just say, and this kind of echoes what we had sent a letter to Congressman Neal sometime last week. And just to echo what's in that letter, speaking of the disparity, specifically, really when it comes to the state pushing money out to the municipalities, any money that can come directly to the city, that would be really important for us across, any kind of funding source, or specifically, but specifically the COVID stuff coming directly to us versus, it gets restrictions put on a federal level, and then to the state, more restrictions put on it, and then the state kind of divvies it out. And we do see kind of less dollars coming out to the western side of the state. I think everybody knows that. So any kind of funding that could be sent directly to us is helpful. I would say the other main point is just making sure that the FEMA obligations are expedited in any way possible, because a lot of the reimbursement for us hinges on FEMA's obligation being approved. So any way that we could kind of push that through would be helpful. I don't know, Melanie, if you have anything to add.
No, that's a great point. Definitely FEMA obligations have taken a lot longer than I think anybody has anticipated, mostly because obviously it's a disaster involving most municipalities in the state, whereas, other disasters like a hurricane or something is like one municipality. So I understand the volume of applications are definitely more than they're used to. However, a lot of our other grant funding sources are pushing off reimbursement until we get word from FEMA, and then FEMA's like, well, no, you got to reach out to the other grant agency to get response on that. And so a lot of it is hinging on a response from FEMA, which we have submitted 2 applications for, and it's moving along the process, but it's really slow. And so I don't know if everybody's keeping up, but there's hundreds of regulations that they're constantly sending out as to, we're going to cover this, now we're not going to cover that, we're going to cover this now. And so that would be something that would be helpful. And to add on to Councilor Whitfield, what you had mentioned before, vaccinations is something that's definitely a concern. If it's going to the burden beyond the municipality to deliver the operations, then we're definitely going to need funding for that. And the push that I've been hearing is that go to FEMA, but FEMA's taking forever to respond to obligations. So that would be something that would be definitely on my top priority list once we get there.
Thank you both. Lindsay, Melly, how much is left in our, if you don't have this number, it's okay. I had asked it at the last meeting. How much is left in our, of our previous relief funds that we haven't spent yet? How much is there?
So you're talking about the COVID relief fund that the city received?
Yep.
Yep. So the city was awarded 13.7 million approximately. So we are charging the expenses onto this grant per the quarterly reporting periods that they're allowing us to do. So far about 5.2 million has been charged on there. A majority of the rest has already been earmarked with current expenses that have been made to our deficit account that we're eventually going to reclass over to that account.
Thank you. And could one of you just share with because I know it's come up in a lot of Councilwoman Whitfield's Finance Committee meetings, relative to the restrictions that's been placed on a lot of the COVID relief funding that we've received from the federal government through the state. And I absolutely echo Lindsay's sentiment of the funds being directed specifically to cities and towns, because we know what our communities need. We don't need the state to place restrictions and tell us what we should be doing to serve our communities. But relative to that, could you talk about the issue of the restriction that has not allowed us to replace lost revenue with these?
Sure. So currently any of the funding that the city has received related to COVID has not been able to be used to backfill lost revenue. So currently the city is looking at about over $7 million in lost revenue since the pandemic started back in March. And, having $20 million to cover COVID expenses is great, but if you are losing revenue to provide city services, it's almost like, I'm going to be having to potentially eliminate services, reduce services, when potentially the opportunity could be there to share that funding to cover both. So that's just something that we hope maybe eventually changes. On the school side, it has changed, but on the city side, it hasn't yet.
That is great. Thank you both so much. And thank you to everybody for joining us. As I said, we try to keep it to an hour, so we're coming up on that. I just wanted to throw at our representatives 2 other quick things just to bring back. One is pandemic unemployment assistance. I know that there's been, that sort of has ebbed and flowed throughout this, but we do have people that have been out of work almost for a year now. Whose industries are not returning yet. And so I know that the senators and the congressmen are well aware of that, but that has to be part of the negotiation. And also on the eviction and foreclosure moratorium, I know that President Biden extended the eviction and foreclosure moratorium, but if there can be any inclusion of additional housing funds coming into the state, or even better, directly to us, and also relative to people with privately held mortgages that are not backed by Fannie or Freddie, they are sort of in a gray area when it comes to the eviction and foreclosure moratorium. So I just wanted to highlight that. But with that, I'm going to bring us to a close. I appreciate everybody for joining us today, especially Melissa, Ray, and Kareem. And I just wanted to give Melissa, Ray, and Kareem a chance to give some closing comments if they wanted to.
Thank you so much for inviting us. We really appreciate it. We've written down all of your concerns. We'll continue to update Councilman Letterman as the package moves forward, hopefully in the next week or so. And just know that your federal delegation is fighting every day for Springfield and beyond. So please feel free to reach out if you have any questions or concerns, or if you forgot something tonight. Jesse has all of our information and we're happy to chat. So thank you.
Great, Kareem.
I echo what Melissa said. Just thank you. And feel free to reach out at any time.
Thank you, Ray. Kareem.
Always a pleasure seeing all of you. I miss being able to hang out in person. However, I hope that you all continue to be safe and healthy. And you all have my contact information. So if you have any additional questions, please feel free to reach out. Thank you.
Are you all local? Are you all local? Okay.
Yeah.
Okay. Good.
I'll share all three contact info. I'll send it around to the whole council. And next week, Kelly, our administrative staff, have extended an invitation to the governor's office and the state DPH to join us. So hopefully we'll get to have some state conversations next week. As long as we get a confirmation back, I'll keep you all posted. Everybody have a safe night and stay warm.
Thank you.